Hey everybody, I'm Mike Krupa, and this week we're going to dig further into the align step of the remodel benefits process, which again means aligning your health insurance plan with partners that have your best interests in mind. And one of the best ways to do that is to understand how each vendor partner within your health insurance plan gets paid, because that will uncover what they're naturally incented to do. And this week we're going to dig into the payment structure of primary care providers and specifically talk about a new payment model in primary care called direct primary care. And today's story is about the average American just like you. You see, the average American only gets about 16 and a half minutes with their actual primary care provider per visit. And this has everything to do with how a traditional primary care provider gets paid. They get paid a fee every time a service is performed, fee for service. And on top of that, their reimbursement rates from the federal government have remained largely unchanged over the last 10 years, which has put significant pressure to increase their patient panel to make up the difference. And it has resulted in the average primary care doctor seeing a minimum of 2,400 patients per year. And that's exactly the reason they're only getting 16 and a half minutes with each patient, because they have too big of a patient panel. 16 and a half minutes is enough time to write a prescription or refer you to a specialist, which is what we see happen all the time in traditional plans. But when you change the payment model to direct primary care, you no longer pay a fee every time the service is performed. You pay a monthly membership fee for primary care, much like a gym membership. And this allows the primary care provider to bypass billing insurance altogether for primary care only, which greatly reduces their administrative lift, ultimately allowing them to have a much more predictable revenue cycle. And this all leads to them reducing their patient panel to a maximum of 600 patients per year. Now that means a patient in a direct primary care model is getting 60 minutes of time per visit versus 16 and a half minutes. And this results in less prescriptions, less ER visits, less specialist visits, ultimately reducing the overall cost burden for the employer as well. And the lesson here is when you focus on how the vendor partners within your health insurance plan get paid, you will uncover their natural incentive structure. And if you then realign your plan to only work with partners that have your best interests in mind, you will start to see different results. Results like this client saw when they implemented a direct primary care plan. And when we compared their results to the plan that had traditional primary care providers in it, we saw huge differences across the board. 73% reduction in ER visits, 28% reduction in urgent care visits, 7% reduction in specialist visits, and 40% reduction in the number of scripts that those direct primary care providers were now prescribing. So amazing results, which are all the things that lead to lower costs down the road. And the action to date is simple. Just go get educated about direct primary care. Ask your broker about direct primary care. It is a transformational model that, when done right, gives you, the employer, the opportunity to make your benefits better and lower your costs. Now, if you're interested, you can learn more about direct primary care right now, as I've also attached a video I've done with one of the premier direct primary care providers here in Illinois, ImagineMD. I hope you enjoy. Thanks.